There's good news and bad news about lung cancer. The good news is that lung cancer has been on the decline for years, and now survival rates are on the rise. But the unsettling news is that lung cancer is still by far the leading cause of cancer death in the United States, accounting for about 20% of all cancer deaths. Everybody, I'm Kendis Gibson, your host for today's discussion, coming to you from the Baptist Health Newsroom. Roughly 240,000 new cases of lung cancer will be diagnosed in 2023. And according to estimates from the American Cancer Society, only about half of those patients will survive the disease. Here to speak about the warning signs and more, we're joined today by Dr. Mark Dylewski, who's the cardiothoracic surgeon at Baptist Health Miami Cancer Institute. Great to have you here, Doctor.
Thank you.
Did I pronounce the name correct?
You did.
It's an important month. I think every month should be considered Lung Cancer Awareness Month because it's such a horrible thing. So I'm very happy to have you here for this discussion. And I should point out, by the way, before we dive into today's subject, I want to remind our viewers to send in your questions and comments in the comment section throughout the discussion. We're here for you and happy to answer any questions that you may have. As you mentioned at the start of our conversation here, lung cancer has been on the decline, but why is it still considered, Doctor, the deadliest cancer in the United States?
Well, lung cancer and all cancer, the treatment for cancer over the years has changed, and there has been a tremendous effort, take for instance in breast cancer, to make the community aware, and also a tremendous amount of money has been raised that went into research to fight breast cancer, because it's one of those cancers that is associated with victimhood, and nobody really knows exactly what causes breast cancer. We know the risk factors, but nobody participates in an activity that specifically puts them at risk for breast cancer, unlike lung cancer. So we've known for 30 years that tobacco use is the main risk factor for those that develop lung cancer. And it's in a community setting, many people may feel that the victim, the cancer patient, brought it upon themselves if they elected to smoke voluntarily. And that's why I think there's been a tremendous lack of attention paid to chest or lung cancer, and the monies didn't follow the research into lung cancer. Now things have changed. They realize now that tobacco is not the only risk factor, and more patients, particularly females between the ages of 35 and 54, are developing lung cancer even if they're non-smokers. So there's more attention brought to the lung cancer patient, and there's more money and research flowing into the research of treating lung cancer. But it remains one of the most common cancers that we see in the United States and across the world, and our treatments haven't caught up with the effectiveness of some of the other treatments for cancers. And so many patients who are diagnosed with lung cancer will ultimately succumb to their cancer.
I mean, about 50%, which is a sad statistic right there. But we mentioned that smoking is also on the decline, and vaping has taken its place. What impact does vaping have on the lungs?
So vaping's an interesting phenomenon, because it was sold as an avenue that was safer than combustible tobacco. And it may be utilized to help assist patients that are smoking to get off smoking. Unfortunately, it sort of backfired because of the way the companies that developed the vape pens marketed them. And they tended to market them to young teenage male and females. And if you have teenagers or children, they're apt to try new things and experiment. They have
different flavors, and they're colored a certain way.
Exactly. And the problem with vaping is that these are electronic devices that can be programmed to deliver a fixed amount of nicotine. Many times the amount of nicotine that's in a single puff of a vape pen is much higher than what you get in combustible cigarettes. So you can imagine that these pens can be programmed so you're delivering to the user a much higher dose of nicotine than combustible cigarettes. So the addiction of vape pens is much higher. The addiction to nicotine is much higher in patients who are utilizing vape pens. So when they go to utilize combustible cigarettes, they're more apt to smoke more frequently and more cigarettes over a longer period of time to get the sensation of alleviating their addiction. So they become very dangerous to utilize, particularly in the teenage years.
So it makes you more addicted to it than your standard cigarette.
Correct.
But the process of actually inhaling what you're inhaling in a vape pen isn't as harsh as what you'd be inhaling in your everyday cigarette?
So
is that what I'm understanding?
So the vape pens have a substance that concentrates nicotine, and it's in its pure form, as opposed to the combustible cigarettes that are processed tobacco leaves. And we know that tobacco, naturally grown, has 4,000 different co-carcinogens and carcinogens that are known cancer agents. Well, vape pens don't have those co-carcinogens and cancer-related products. However, this nicotine is passed through an electronic device that's heated up and turned into a vapor.
Yep.
And we know that the pens release chemicals when it's heated at very high temperatures from the element that's heating it up, and also the formula that the nicotine is dissolved in, that turns some of the chemicals into carcinogens as well. And they're at very minute concentrations. So we don't actually know what's going to happen over the long term. The research has not been performed looking over a long period of time whether these vape pens also contribute to the development of cancer.
But if you're recommending to somebody right now who has been smoking cigarettes for years and they were like, okay, I need to wean myself off, let me go to a vape pen, would you say yes or no?
So I, as a physician, when I'm counseling my smoking patients on smoking sensations, I do truly believe that the vape pens are a safer product than using combustible cigarettes when utilized properly, when the patient understands how to program them and slowly wean the concentration of nicotine being delivered to them. And I think it's an effective device.
There's a but.
But I don't recommend it for someone to utilize vape pens who are young, experimenting with tobacco use, because not only will they become more addicted quicker, but they will likely begin to use combustible cigarettes at a higher rate than patients who are non-vape users. And so there's a danger there. In addition, there's also the vape-related lung disease that we see quite frequently. It's a relatively new phenomenon over the last 5 years. We've had a number of teenage victims, if you would, that have died from vape-related lung injury, and we don't quite understand what the cause of it is, but we're seeing it more and more frequently.
And that's really alarming. And the study's still out on why that is happening.
Absolutely.
I want to get your take, and I know you saw this study, that there's a new study that came out from the American Cancer Society where researchers found that women are getting lung cancer at higher rates than men.
So that's an interesting study that was published. So overall, the incidence of the use of tobacco is decreasing in the United States. And they looked at certain ranges of years between 2000 and 2019, and they compared women to men. And they saw that the incidence of lung cancer in men were decreasing over those range of years. However, the incidence of lung cancer in females between the ages of 35 and 40, or 35 and 50, and also 50 and 54 are increasing above the incidence of men for the first time. And they don't quite understand why that is the case, but it's an interesting finding that came out in that recent publication.
Yeah, it contradicts what we've known for some time now in that industry. I want to get your take also on those who have never smoked. I remember I had a friend who died of lung cancer, and she's never smoked. Kathy Griffin, the comedian, was diagnosed with stage 1, and she had a tumor for 10 years. Do we have any idea why this is happening?
So that's a perplexing problem, and I see about 1,000 new cancer cases a year in my own practice. And if you look at the statistics, about 15 to 17% of all lung cancer cases diagnosed in the United States are in non-smokers, mostly in females between the ages of 50 and 70. So we know that these folks are non-smokers. Some of them have some secondhand exposure, but not all. And we don't know exactly why we're seeing this increase in lung cancers in this patient population. It may have a relationship to genetics. It may have a relationship to hormone therapy or drug therapy that they're taking, or exposure to other chemicals like radon or some of the other chemicals such as asbestos during their lifetime that may have increased their risks. But we actually don't know the particular detail that causes this increased incidence in non-smokers of lung cancer.
And I want to get your take also, because us living here in South Florida, it's of particular concern. Why is it that lung cancer is a key concern for the Hispanic community?
So, very good question. So we tend to look at populations of patients, particularly in South Florida, because we have a large percentage of minority groups, Hispanic groups, and white men and women. And we follow the trends and the incidences of lung cancer. And I mentioned earlier that we're seeing a trend in decrease in incidence in men, white men, and an increase in white women. Blacks, however, Black Americans have a much higher incidence of developing lung cancer for various factors, and the results of treatment in that patient population, both men and women, are less than the success is less than what we see in white men and white women. And we think it has something to do with socioeconomic aspects of life. Perhaps Black men are known not to participate in smoking cessation programs as much as white women and white men. But the Hispanic population is interesting because the incidence of lung cancer in the Hispanic population is much less than Black, white, and Black individuals, and it's about half the incidence of what we see in Black men and Black white males. So it's interesting. So they do have a socioeconomic culture that, for all intents and purposes, protects them a little bit from the development of lung cancer. And it may be the fact that Hispanics are less likely to adopt tobacco use and such things like that. But we know that the incidence of lung cancer, fortunately, in Hispanics is lower than what we see in Black Americans and white Americans.
Well, we have a lot of viewer questions, but I want to squeeze one in really quickly, because a lot of people, you had that Kathy Griffin diagnosis where she had a tumor for 10 years that went undiagnosed. How do you know that you have a potential problem?
Well, there's a national screening program that's been developed over the last decade or so. And we tend to target patients that are at high risk, and they're easy to identify. Those patients that are 50 years old or older, who smoked for 10 years or more, who may have a family relative who's had lung cancer and so forth. And so that population is easily identified, and we offer them screening. However, the patients who are non-smokers, that's the more difficult, challenging group to identify. I typically tell my patients, particularly females and males that come into my office that are non-smokers, that have lung cancer, I educate them about talking to their family members because we think that there's a genetic relationship between lung cancer and the development of lung cancer in non-smokers.
Well, doctor, we could go on and on about this because it's such an important topic, and the sense I can get is there's more that we don't know than what we do know about lung cancer right now.
That's always true about all cancers, but we have improved our education and our knowledge about treating cancers in all forms, particularly in lung cancer. The survivability is improving, particularly with the new drug therapies that we have available. So there's hope in the future.
I'm glad to hear that. All right, thank you so much.
You're welcome.
Great conversation.
My pleasure.
Appreciate you being here for it. And remember that be sure to hit that subscribe button on our channel here to keep up with the very latest health and wellness information and tips from our experts, including the good doctor right here. And you can also connect with us on social media channels, Facebook, Instagram, Twitter, TikTok, LinkedIn as well. And check out our resource blog for the latest news at baptisthealth.net/news. You'll find a link there to all our episodes of the Baptist Health Talk podcast as well. On behalf of everyone at Baptist Health, stay safe and stay healthy. Thanks for watching. you.